Hi, I'm Faye, and I'm a longtime resident of Thailand. In 2017, I woke up one morning and my groin muscle had just locked up. Now, I'm a ballet dancer, ballet teacher, and I lost complete range of motion. I used massage to try and recover as much as I could. I never suspected that that was a hip problem. Then eventually, after 2 years, I thought maybe I should have a doctor look at it, and he said that there was a narrowing of the joint, but nothing that would require hip replacement, which I was shocked to even hear. And over the next year or so, it just got worse and worse. And I think what made me finally make the decision to go back and see a doctor was that I was uncomfortable dancing. I felt like, you know, how much longer? I felt old. I never felt old before. I was up there dancing on my toes, you know, for hours every day, and all of a sudden, I just didn't want to do it. But one day I went to walk to the beach with my old dog, and I just found a bench and sat there, and I went, something has to happen. And this is what a couple of friends of mine who'd had the same situation said, you will know when it's time. However, I think I should have noticed 2 years earlier. I've been using Samitivej since maybe 35 years now. And I did try to look at doctors at other hospitals that had been recommended. And I felt that Dr. Kriskamol at Samitivej was really listening to me and looking at my particular needs. Not that he would get me back on my feet and walking, which is, we all hope that we're back walking, but to be able to do ballet again was a challenge that I think he rose to, and he was excited to see how well he could, you know, restore what I had before.
The patient come to the hospital with the symptom of chronic hip pain and limit hip motion. So the diagnosis of the patient is osteoarthritis of left hip. Due to her career, she is the ballet teacher, so her concern is her post-op range of motion and her return to normal active lifestyle. So we choose the special implant for her in this case also. Following surgery, our patient will be in the post-operative rehabilitation program for 1 or 2 months under supervision of the experts. After that, she will have the close follow-up to ensure her smooth recovery path. One of the biggest concerns for ballet athletes like Faye is return to their active lifestyle. This case, the patient regain pre-illness activities as evidenced by clear success of the procedure, demonstrated by full range of motions without any impingement and affirmed by post-op X-ray.
So I had my surgery in the beginning of December. I had the holiday, and then the first week of January I was back teaching, but with a very limited range of motion. I was able right away to use crutches. I just used a walker for about maybe 2 weeks. And from there on, I just diligently did all the exercises I was supposed to do. And I have a good sense of my body. I was able to feel what was okay. I checked with the doctor regularly. I would come in and I would you know, say, when can I do a step like this, when can I do that? And he would give me a timeline and say, okay. Then I brought in my point shoes. First I asked the doctor, when can I go back on point? And he was 6 months, maybe that's the day that they let you go back to whatever you're doing. But I thought, I don't think he knows what a point shoe is really. So I came and put it on the unoperated leg, and I stood there, and the poor doctor just kept looking up and down and going, how do you do that? But it's completely natural for me, and 3.5 months later I was back on them. I could feel it was fine. So I think it's very important to do everything you can before you have surgery, which is to, if you can lose weight, it will always make it easier. If you can get fit and in a gym, there's exercises you can find on YouTube to prepare yourself for it. The fitter you are, the lighter you are, and the healthier in general, you'll heal faster. I'd had a cesarean section. That's the only other surgery I've ever had, and that's extremely painful. So I assumed that with all the chopping, sawing, cutting, this would be very painful also. But I was completely surprised that there was almost no pain. I still don't understand, and I was not on any opiates. I was just on a anti-inflammatory, and I still think it's like science fiction that all that could happen, and I felt almost no pain. I started with the physical therapy the next day, and of course the physical therapist, first thing he said to me was, "Wow, you're strong." And I said, "Yes, I am." So I would say the difference from person to person is, there's quite a range of people who come in for hip replacement, from somebody who just wants to be able to walk again, and from somebody who wants to continue with the sport. And I think my final word would be to say, don't suffer too long. If you are having pain, don't be afraid to have the surgery. It's very, very successful, and you don't need to suffer any longer than is necessary. And I feel now that I'm back to about 90–95% of what I had before, and I'm also older. So that's really way beyond my expectations.